Coping with COVID and In It Together SC present Wellness Wednesday, brought to you by the Diabetes Action Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Tre Tailor.
Happy Wellness Wednesday. I'm Tre Tailor, and In It Together SC and the Diabetes Action Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. I'm Tre Tailor. Today, it's time for us to be joined by Dr. Jane Kelly. She is Assistant Epidemiologist with DHEC. And when we see you, Dr. Kelly, we know it's time for our COVID update. Listen, it's been a month since you've joined us, and you have a lot of updates. So we'll join Dr. Kelly right after the PSAs to tell us about that. Plus, last month was Eating Disorder Awareness Month. We're going to talk to Sabrina Johnson with Legacy of Love Counseling. She's going to tell us how prevalent this is, particularly for the Black and Brown community, and what she and others like her can do to help folks with eating disorders and with other stressors due to COVID. And there's been plenty, right, Sabrina? Thank you, ladies, both so much for joining us. We'll come back with more Coping with COVID with Tre Tailor from In It Together SC and the Diabetes Action Council of South Carolina. But first, your COVID community updates. For the most up-to-date listings of times, dates, and location for COVID testing, flu shots, and also COVID vaccination, visit scdhec.gov. You can actually get those 5 free rapid self-COVID tests still by logging on to covidtest.gov. I mentioned to you before that I ordered mine already and received mine in just a couple of weeks. COVID vaccines are also available at Lexington Medical Center. If you are a veteran, you can get your COVID vaccinations through the VA. Kroger pharmacies are also offering COVID vaccines. Check the screen for more details about that. CVS is offering COVID vaccines also at all of the locations, including those of Target stores. Walgreens is also offering COVID vaccines, and they are also offering free N95 masks. Speaking of masks, that's one of the things we're going to talk about with Dr. Kelly a little later on. Also, Brooklyn Baptist Church's vaccine clinic is still open 7 days a week. Stop by their location on Sunset to receive your COVID vaccine. And if you're having a challenge getting to your COVID vaccine, don't miss your shot. The Comet bus system is actually giving free rides to the Comet. Not only that, they have COVID vaccines set up at their main location in Columbia, South Carolina, at the corner of Main and Sumter Streets. Now, if you're having some technology challenges setting up your COVID vaccine, the folks at Get Set Up can get you set up. Again, that information is on the screen. Check the folks out at Get Set Up, and they can help you get set up to make your COVID vaccination appointment. Still, money's available through FEMA for COVID funeral reimbursement. If you know someone, a loved one, a family member that has passed away due to COVID, FEMA is offering funeral reimbursements. The South Carolina Bar Association and SC Legal Services has a toll-free number and website for rental and mortgage help. Still, so many other financial assistances available. Lexington County has a bill assistance program. SC Housing and Dominion Energy has a rental and utility assistance program. SC Hopes has a 24-hour assistance line from the South Carolina Department of Mental Health. If you or someone you know is having a challenge coping with COVID, please contact the folks at SC Hopes. That's one of the things we're going to talk about with our guest in the next 30 minutes, Sabrina Johnson with Legacy of Love Counseling. Also, the Women of Power National Summit is going on this month, March 9th through the 13th, virtually and in person. Again, that information is on the screen. So if you want more information, you can contact the folks at the Women of Power National Summit. With all of the great things going on in our country for women in leadership positions, this is going to be a conference you won't want to miss. You're watching Wellness Wednesday from In It Together SC and the Diabetes Action Council of South Carolina. They sponsor Wellness Wednesday every Wednesday here on Coping with COVID, and we're actually streaming live on the In It Together Facebook page. Please go over there, hit like and share and follow. Not only will you be able to watch Wellness Wednesday every Wednesday, you'll also be able to get all kind of great information and resources on that In It Together Facebook page. Go over there and check it out. Now, we're also streaming live on the Facebook page on Tailor Made Productions. That's the home of Coping with COVID. Please go over there, hit like and share and follow. Also, because not only can you watch Wellness Wednesday, but also Coping with COVID on Thursday and Friday at 2 p.m. Eastern. You can also get all of your COVID-related updates. So many great resources on that page. We're streaming live also on the YouTube channel. Please go over there and hit the subscribe button. And if you want to watch past episodes of Wellness Wednesday or Coping with Tre Tailor, the YouTube channel is the place to be. We also have a presence on Twitter and also on Instagram. Now, listen, all of the information that I just mentioned to you, all of the resources are available throughout the show. Look at the scroll at the bottom of the screen, and all of that information will be scrolling. Also, we want you to post this information out so we can get the message to the masses. We are providing such great information to our community, and please post and share, like, and follow. Well, a lot has gone on in the last 30 days since we've talked to Dr. Jane Kelly. She is Assistant Epidemiologist with SC DHEC. Dr. Kelly, thank you so much for joining us once again. We appreciate it.
No, thanks for inviting me.
Absolutely. So tell us just kind of in general, before we get into the meat and potatoes of it, so to speak, what has changed in the last 30 days? We've heard a lot of things. Is it better? Is it worse? What's happening, particularly in South Carolina?
Many, many things have changed. And I do have good news, but I'm going to deliver it in a cautious manner, because I don't think we want to adopt this just let it rip sort of attitude. The good news is that, especially in South Carolina, we have had a decrease in the number of new COVID cases every week for the past 6 weeks. And it has really plummeted. I mean, it's been a very sharp decrease. We had been at the point where we were having literally 20,000 new cases a day. It was shocking. That was higher than we'd ever had before. And now, most recently, we have been averaging about 300 cases a day. I mean, it's a very sharp decrease. The little bit of caution I want to put in there is that we don't capture tests that are done at home. And so, if you're at home and you do your test and you turn positive, you don't report that to DHEC, so we don't know about it. So, I think when I say 300 cases in a day, that's a minimum. Those are the ones that are reported to us. Certainly the ones that school nurses do on children at school, that gets reported to us. But those at-home tests do not. So take it what I say with a grain of salt. Yeah. I think things have decreased, but maybe not as much as we think.
And a lot of people, because there is greater access to home tests, a lot of people are doing those home tests.
And that's a good thing, because those tests are highly reliable and people will get information faster so they can take action faster. So that's a good thing.
Yeah. Dr. Jane Kelly joins us. She is Assistant Epidemiologist with SC DHEC, and you are watching Wellness Wednesday on Coping with COVID from the Diabetes Action Council and In It Together SC. All right. So cases are going down dramatically, but again, it's not the precise numbers because of the at-home tests. Why do we think the decrease is happening, Dr. Kelly?
Well, in South Carolina, we've got about 54% of people age 5 and up are fully vaccinated. Wow. We'd certainly like that to be higher, but that it plays a role, because we know that breakthrough infections, getting an infection after you've been fully vaccinated, it's still rare. Sure, it happens, but it's rare. And most people who get infected that way do not go on to have severe disease. The biggest issue, though, is that Omicron, the variant that is way more than 99% of the new cases in South Carolina and in the nation, just spreads more easily. It's more contagious. And it seems to have a shorter incubation period. That's the period of time from when you're exposed to when you get infected. So it has just, kind of zoomed through South Carolina. We had a huge spike in the number of cases in January, but it's also come down just as quickly.
Wow. Okay. All right. Now, what about hospitalizations?
Yeah, that's the most important indicator right now. And that's part of CDC has shifted its recommendations about what we monitor for making decisions about businesses and employers or school settings, how we act as a community as a whole. And the shift still looks at cases. We're still looking at new case numbers. That's still important. Even if we're making an underestimate, we still count it. But the other things that we're looking at are hospitalizations for COVID or with COVID, and also how overwhelmed are our hospitals? Where are they in terms of capacity? Now, we've never been overwhelmed in South Carolina, but other states have, and there have been problems with, keeping staffing in the intensive care unit. We don't want to get at that point. So we're keeping an eye on those measures of the number of people in the hospital. So the number of hospitalizations increased with that big surge with Omicron. About 2 weeks later, we had a big surge in hospitalizations and unfortunately a surge in the number of deaths. But both of those are coming down now as well.
Right. Dr. Kelly, I know you are, work primarily for the most part with South Carolina through SC DHEC, but what about the numbers in our neighboring states? I mean, we're right down the street from North Carolina, right down the street from Georgia. What are those numbers looking like?
Interestingly, Georgia looks an awful lot like us. I recently looked up their numbers in terms of percent vaccination and the number of new cases per 100,000 people. And I guess maybe their politics, honestly, their demographics are similar to South Carolina. So I suppose it's no surprise that their numbers look similar. North Carolina is more vaccinated than we. Wow. And so North Carolina, they started unmasking a little bit earlier, changing their school guidelines a little bit earlier. And their statistics in terms of number of cases, hospitalizations are a little better than ours. And I think those things go hand in hand. If you've got more people vaccinated, you got more people protected.
Yeah. And as you said, as far as Georgia, the North Carolina thing could be politics also.
Sure.
Their political leadership. Dr. Jane Kelly joins us. She is assistant epidemiologist with SC DHEC. I'm Tre Tailor, and you're watching Wellness Wednesday from In It Together SC and the Diabetes Action Council. Dr. Kelly, I'd asked specifically about Georgia and North Carolina because they are neighboring states. And, people from South Carolina very often travel to visit, to shop, to party, we'll go to concerts, things like that. So those types of things, I think, make a difference. You mentioned the unmasking thing, and that's definitely something I want to talk about because the CDC has come out in just the last couple of days and said that now they've changed their mask requirements. Can you talk a little bit about that, please?
Yes. And this is, again, a place where I want to interject a little bit of caution. And in fact, I want to mention what's going on right now in Denmark. And the reason I say that is, I know people may feel like, wait a minute, South Carolina and Denmark, you can't compare those two. No, but we can learn from their experience because they had mask mandates. They had vaccination requirements to enter public spaces. They had a lot of things in place, and they dropped all of them February 1st. They just said, boom, we're going to rely on vaccination. We're going to rely on personal responsibility. If people get Omicron, we're prepared. And they had a startling surge in cases, hospitalizations, and unfortunately deaths. So as we talk about these, CDC recommendations, remember this: saying you may take your mask off doesn't mean that you have to take your mask off.
Or that you should.
Right. And I think we also need to remember that, you just because you might be young and healthy and, not worried about COVID, you don't know who you're sitting next to.
Right.
It's estimated that 1% to 2% of Americans are immunocompromised. And certain conditions like lupus, like sarcoid, they're higher in communities of color. They're higher, especially in women of color.
Yeah.
And so as you think about, what safety measures, if you take off your mask, what other safety measures do you put in? Because it's no single thing. If you remove one thing, you should add something else, strengthen something else. And what that to me personally means vaccination, because I know that is the single most effective way to prevent severe disease with COVID.
Yeah. Well, of course, this show is sponsored by the Diabetes Action Council. And of course, with In It Together SC, we talk a lot about pre-diabetes and diabetes prevention programs. And of course, as you said, those are some of those pre-existing conditions that make you more highly susceptible to catching everything else, including COVID.
And I think right now we're in a special time with so many people recently had COVID with Omicron. I think I've said in previous times when we've talked that if you had a variant that was, from last year, you had Delta or one of the earlier variants, don't feel that you're protected against Omicron. Omicron is different. But it does look like if you had Omicron with this big surge, that you are in a time of relative protection from getting reinfected with it or with that other variant, that new one, Ba2, that has been in the news. We've only found a handful of cases of Ba2 in South Carolina and in the United States in general. But right now, it does look like Omicron, if you had an Omicron infection, it protects you. So as you said, CDC has changed their recommendation. We're changing our recommendation. People can have more latitude about taking off their masks, but use your head. If you're in a crowded indoor setting,
use your head as a mask. To hold your mask up.
It's still out there, so we should still have some caution and make some good judgments about behavior.
Well, so Dr. Kelly, let me ask, what is the new CDC ruling about masks, and what are we saying here in South Carolina about that?
Well, what they have changed, and we're adopting this change yet. It's not on our website yet. So much has happened recently. It's taking a little time. We should have this up by the end of the week. But we used to look at by county. How are we doing in terms of, we would look at the measurement of how many cases per 100,000 population in the past 7 days. And we would also look at the term is percent positivity, how many of the tests we did, what proportion of them were positive. And we're moving away from those measures to look at what's more important is not just counting the cases, because the cases may be asymptomatic or mild infection, but to look at the strain in our hospital system, because that's the most important thing, avoiding overtaxing our hospital system and looking at how many people are having severe disease. So what CDC has recommended and is up on their website, and I can actually show an image if you want me to share an image.
Yeah.
That CDC is now recommending, let's look at 3 measures. Let's look at cases. We're still going to look at cases, number of cases per 100,000 population. But let's also look at how many people with COVID are in the hospital in a 7-day period of time, and what percentage of hospitals, where are they in terms of their capacity, and to do this by county. And, even though I said counting the number of cases is tricky, and it's an underestimate right now because we're not getting the at-home tests, we have pretty good data on the hospital. The hospitals send us information about how many people they have on the wards, in the intensive care unit, on ventilators, so we can keep a good measure of those metrics. Mm-hmm. It appears very different moving from the old way of counting risk to the new way of counting risk. And what is important about it is that if you're in a county that has a low level by these new measures, then the recommendations are simply twofold. Get vaccinated and get tested if you have symptoms or you think you've recently been exposed. If you're in a county that has a high risk by these measures, they have more recommendations. They have recommendations of put your mask back on. Be careful. Still those other recommendations at testing, vaccination, but there are some other recommendations.
Yeah. So I guess, it depends. As you said, it really depends on the county. So,
do you want me to show a map of South Carolina with that?
I would love for you to. We have such a wide reach here on Wellness Wednesday. I want to give people the information as to know what they are supposed to do. But in general, please share the image. But in general, Dr. Kelly, while you're doing that, is it when you're outside, you don't have to mask, but if you are inside, and let me bring this up, if you're inside, you do need to?
So it was always true. Hang on a second. Sorry that I'm zooming past.
No, it's okay.
This is the old way we used to look at it.
Okay.
And this is still up on our website because, as I said, we're challenged with getting everything updated. And in this, looking at percent positivity and number of new cases, it looks like, most of South Carolina is either high or substantial
And
transmission.
that's the orange is the high, right?
That's right. That's right. But the new way of doing it is looking at those other measures. We have a little bit different picture.
Right.
We still have a lot of counties that are high, but we now have some counties that are in the low or in the medium. And what does that mean? So here's ways that you can measure it, but what does that mean? If you are in a high county, then we are definitely recommending mask indoors in public.
Tell us a couple of those counties.
Can you? Mostly we're talking about upstate. So, York County, and let's see, I'm going to show my ignorance of the South Carolina counties, but I think people can look at this image and recognize their home county.
Yeah.
I
don't, so that's why I was asking. I don't know where.
I mean, some of our high counties, I think Richland is still in a high county, and Lexington's still high. York, Cherokee, is that Greenville? I'm sorry, I'm obviously a Yankee transplant that I don't know my South Carolina map well enough. But more importantly, I think, is to talk about, what does this mean?
What is what, right? So if you're in a high, what is that?
If you're in a high, please keep your mask on indoors right now. You do not want to overwhelm your hospital. We really vary around the state in terms of hospital capacity. We know we have some counties that don't have a hospital. And then the way this measure is figured out is what county hospital, in another county, in their catchment area. You don't want to overwhelm any of those. So if you're in a high county, still recommending you wear your mask indoors. If you're in a medium county, then the recommendation is use your judgment. If you're at high risk for severe disease, you have diabetes, high blood pressure, heart disease, liver disease, kidney disease, and you're not vaccinated, then you really should wear a mask. And honestly, if you still have questions about vaccination, email me directly. I would be glad to talk to people. I know there are folks out there who are still vaccine hesitant, and I can help answer some questions.
We can see Dr. Kelly's information right there on the screen. As she said, she's been such a help here to us here on Wellness Wednesday, and she is open and ready. As she said, give her email her if you've got a question. Let her know. So if you're in those high counties, you definitely need to mask up. If you're medium, you need to take into consideration your personal situation. And then if you are in the low areas, you don't have to mask up.
Yes, but you can, of course, choose to mask at any time. Right. What if you are that person living with lupus? What if you are a person living with HIV, living with diabetes? Then you might decide, I'm not going to take any risks. I'm still going to mask. But I think the idea behind this is to try and be reasonable. If you're in a county with low community levels, because of high vaccination rate, or because many people just recently had a surge in Omicron and they are right now pretty immune to getting another virus, or pretty immune to getting severe disease, then you can relax a little bit. I think this is just trying to give an effort for people to return to some semblance of a new normal if you're in an area that has low risk.
Yeah. Dr. Jane Kelly joins us. She is assistant epidemiologist with SC DHEC, and she is joining us today on Wellness Wednesday from the Diabetes Action Council and In It Together SC. I'm Tre Tailor. We are streaming live on the In It Together Facebook page. Please go over there, hit like and share and follow. And we're also streaming live on the home of Wellness Wednesday and Coping with COVID, which is the Tailor Made Productions page, again, on Facebook. We're also streaming live on YouTube, and we have a presence on Instagram and on Twitter. Please post and share this information out. There's still so much confusion, Dr. Kelly, as to what to do now, so I want people to post and share so we can get the message to the masses. You mentioned briefly about the new variant. Before you leave, I do want to talk about the Ba2 variant. You said there has not been a lot detected here in South Carolina, but tell us a little bit about what's different and how people can know that they've got this as opposed to the Omicron or the regular good old COVID that we've had since 2019.
In terms of symptoms, in terms of the test turning positive, in terms of whether it's going to cause more severe disease, it's no different. It's the same as Omicron. It may be more contagious, meaning it may spread a little bit more easily. Sorry, I'm just turning off my phone.
You're getting your own COVID update.
In terms of it may spread, there is some evidence that it spreads even more quickly than Omicron, but that's shaky evidence. I mean, we're not seeing that in South Carolina or in the nation as a whole. We're seeing a scattering of this new variant. So just to reiterate, doesn't look like it causes more severe disease. Maybe it spreads more easily, but the good news is if you are vaccinated or you had recent Omicron infection, you are likely protected from severe disease by this new variant. But it's not going to have different symptoms, and we wouldn't treat it any differently. And I do want to remind people that if you test positive, there are treatments that can help prevent you from going on to having severe disease, but they have to be started early.
Right.
So some of them have to be started within the first 5 days of having symptoms. So if you have symptoms, don't sit at home and think, it's probably just a cold. Find out, because it could make a huge difference. Find out, get tested. There are free at-home tests that are free. You can get them from the health department. Like you mentioned, you can order them from covidtest.gov. Get your free test and use it.
Yeah, before you leave, I've got two more things I want to mention. You're so right about getting your test. Just a couple of weeks ago, we had Dr. Nicole Edwards on, and she was talking about something totally different, but my throat was a little scratchy. I was, my nose was running a little bit, and she asked me, and I said, well, I didn't think I had COVID, but she said that the flu, there are very much higher numbers of flu that are, going around in South Carolina. So I got my flu test and my COVID test. Thank God I was negative for both. But two things I want people to be conscientious about, and I've been saying this, is flu numbers are up. So you don't know what, you need to make sure, you need to rule out that. The other thing, Dr. Kelly, I was surprised about is I went to Doctor's Care, and Doctor's Care accepted my insurance, and I didn't have any out of pocket at Doctor's Care for both tests. And that's a place
excellent.
where you can get both tests. So
excellent.
Want to mention that too, because usually, people think, urgent care, Doctor's Care, oftentimes it's a little pricier. But because I was getting both the COVID and flu tests, my insurance covered it. And I got just regular insurance. I don't have nothing special. You know what I'm saying? So the other thing before you leave, I want to ask you about is our children. I did hear a story on the news just a couple of days ago about perhaps the kids booster, or not the kids booster, but the kids vaccine not helping as much because they don't get the full, the full enchilada. So they're thinking maybe boosting kids. Tell us about that.
There is a new study out of New York State, which does excellent epidemiology, but I just want to point out it's what's called a preprint. Like, it's not been thoroughly reviewed, checking their statistics. So, again, you have to, wait for this to be verified. But in that study, what they found is that for kids who are vaccinated age 5 through 11, they had more breakthrough infections than teenagers, ages 12 through 17. Mm-hmm. Now, of course, the vaccine dose for ages 5 to 11 is a third.
It's less, right?
It's much less than so we're learning, and it may be that the vaccine recommendations may change for that age group. It may be that we should have given a higher dose, that may change. But I do want to emphasize that it is still effective in preventing severe disease. It's true, it's not as effective as for the adolescents, but it's still worthwhile. It's still worthwhile for protection against severe disease.
Right. And then, so should our children go ahead and continue to mask up? My babies are 3 and 6. So what do you think?
I think it depends upon a number of things. If you've got a child who's under age 5, we still don't have a vaccine for them.
Right.
So, and it's true that children in that age group are less likely to have severe disease. but that, it's not like it's impossible. We certainly have had children in that age group, unfortunately, die in South Carolina, or children in that age group who have been in the hospital, in the intensive care unit, on a ventilator. And, I think that the experience of wearing a mask maybe is not fun, but it's way better than risking being in the hospital.
Absolutely. I think our kids, I know my two are, I think they're just used to it now.
Yeah.
They adapt easier. And we're going on 3 years now. So for many kids, this is
this is normal.
Yeah. This is just, So, Dr. Jane Kelly, Assistant Epidemiologist with SC DHEC, joins us once again for our COVID update on Wellness Wednesday from It Together SC and the Diabetes Action Council. Dr. Kelly, as always, thank you again so much for sharing your time and your expertise to give us all this information. Thank you for being on the front lines, getting the information to share with us. And thank you for your husband's cute shorts in the background. Listen, I have to tell you, he was so concerned about the dog. The dog was quiet. He was the one making it.
Well,
he kept walking back and he kept looking. I was like,
the times where I have listened to other speakers like Dr. Fauci, and I'm always looking at, what books does he have in his library? What's that a picture of? Well, now you know a little bit about what my life is like.
That's right. No books for you. It's a cute man and some shorts and the dog. Dr. Kelly, thank you again so much. We appreciate you.
All right. Well, thank you for getting the word out.
Absolutely. Absolutely. Dr. Jane Kelly is the Assistant Epidemiologist with SC DHEC. I'm Tre Tailor, and you are watching Wellness Wednesday on Coping with COVID from In It Together SC and the Diabetes Action Council. Coming up next, one of the consequences of COVID we know has been the surge in mental health cases and eating disorders. Last month was Eating Disorder Awareness Month, and we've been trying to get this beautiful lady on since then, and she's going to join us next. Sabrina Johnson with Legacy of Love Counseling joins us next on Wellness Wednesday. I'm Tre Tailor. We'll be right back.
Hello, my name is Kimberly Aiken Cockrum. I was Miss America in 1994. As a result of that, Hello, my name is Kimberly Aiken Cockrum. I was Miss America in 1994. As a result of that, I had to learn at a very early age that it's important to take care of my health, to get enough rest, to eat a balanced diet, and to get exercise. Those are principles that I still live by today. Take a moment to visit inittogethersc.org to take an online test to find out if you're at risk of prediabetes and how to join a diabetes prevention program that takes the guesswork out of losing weight, eating better, and being more active. You can learn new ways to stay healthy and sustain those changes over time. When you join, you'll get support from a trained lifestyle coach to help you set and achieve realistic goals. Go to inittogethersc.org. Brought to you by the Diabetes Action Council of South Carolina.
Computers, they're a part of our everyday lives, but when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall, 803-351-5821.
The Comet gives me a reliable source of transportation.
It's very convenient to me, and they have wonderful drivers.
It's clean, and it builds community. It's fun to meet people.
It makes me feel like really independent. It's just fun.
It's always going to be there, and it gets me everywhere I need to go.
We try to ride every single day. Comedy is our livelihood.
Thank you so much for joining us on Wellness Wednesday. The Diabetes Action Council and It Together SCs bring you Wellness Wednesday every Wednesday here on Coping with COVID. I'm Tre Tailor. Hey, don't forget that we are streaming live on the It Together Facebook page. Please go over there, hit like and share and follow. Not only will you receive notifications as to when to watch Wellness Wednesday, but they've got such great resources and information available on the It Together Facebook page. The home of Coping with COVID is the Tailor Made Production Facebook page. Please go over there also, hit like and share and follow. And check out Coping with COVID and Wellness Wednesday, Thursday, and Friday at 2 p.m. Eastern Standard Time. And then first Monday, Fun Day Monday with George Wallace. Want to shout out George, who's been under the weather the last couple of months, but we are sending our prayers and good wishes out to him and J. Anthony Brown also. We have been working on providing you some great information. One of the things that we wanted to talk about last month and just didn't get a chance to, it was Eating Disorder Awareness Month. Sabrina Johnson joins us. She is with Legacy of Love Counseling and Wellness. Her virtual practice, and she's CEO and primary therapist at her virtual counseling practice. And she's a doctoral candidate in counseling education and supervision at the University of South Carolina. Sabrina provides individual counseling to Black and Brown women seeking help with anxiety, depression, eating and body image concerns, and self-development concerns. Also, she works with couples counseling and to Black and Brown couples seeking premarital and marriage counseling. Thank you so much, Sabrina, for joining us today. We definitely want to talk about the eating disorder today, but I want to bring you back to talk about some other things because you, one, are really focusing on Black and Brown people, which I think that is a separate, we have different challenges than a lot of other folks do. You know what I mean? So I love that. But let's talk a little bit about eating disorders, because I think it's one of those hush-hush things that a lot of people don't talk about. Tell us, first of all, have eating disorders, I know that the mental health awareness has really increased during COVID. Has eating disorders been one of those conditions that have increased also?
Yes, first, thank you for having me. And like all the other mental health concerns that like anxiety, depression, eating disorders have increased as well. Being isolated, having food shortages and, having a lot of time by yourself, experiencing increased stress, like all of those could be triggers for people who have eating disorders. So like everything else, eating disorders increased as well.
Tell us about what are some of the most common. I know we've probably heard of anorexia and bulimia. Those are the two most common.
So the ones that we most hear people talk about is anorexia, bulimia, or binge eating. Anorexia is where you're restricting your eating. Bulimia is where you are purging and binging, but binge eating is where you're just eating large amounts of food in short amounts of time. And so there are other types of eating disorders too. Atypical anorexia. So a lot of people think when they hear anorexia, it's like the really underweight people or low weight individuals. However, that's only about 6% of the population. A lot of people actually have atypical anorexia, so they engage in the same behaviors, but they're not underweight. So they're still restricting their intake. They still have a fear. They're still having severe body image concerns and the distress that comes along with anorexia too. They're just not underweight. And so there's also something else called orthorexia. I know everybody's kind of on a health kick. We live in a very heavy diet culture. So with orthorexia, people have an unhealthy obsession with eating healthy or being healthy.
Wow.
And so this can also cause people to restrict their intake or to focus heavily on, just the healthy foods. Like they won't eat foods with certain ingredients in there. They look for all the natural foods or the pure foods, the raw foods.
Yeah.
But it still causes a lot of distress. So they might have really cause issues with like going out with friends, because if they don't have some of their safe foods there, where they like the natural foods or the raw foods, then they're probably not going to go. So it can be a very isolating experience too. And it can cause issues and like weight changes and stuff as well.
Sabrina Johnson joins us. She's with Legacy of Love Counseling. She specifically focuses on Black and Brown women with eating disorders and Black and Brown couples for premarital and marital counseling. So Sabrina, how do you know when you're having a problem? When does it,
Mhm.
when is it just, I am eating a little bit too much, or
Mhm.
because, you were talking about the health food thing. That would be me, except for I love chocolate chip cookies. I'm gonna eat my chocolate chip cookies, but everything else I'm kind of, really focused on. But so how do you know when you're having a problem?
Yeah, so some indicator factors would be like if you're constantly thinking about like what to eat, how much to eat, where you can eat, what foods you can eat. A lot of times it creates a lot of distress for people, so it's really isolating. So with eating disorders, there's a cognitive component as well as an emotional component and a physical component, which makes it one of the most deadliest mental health concerns out there. So physically, you can start to notice, like for women, you might lose your menstrual cycle. You might feel
Because
cold.
you're not eating
Right,
correctly.
you're not giving your body energy because that's what food is energy. So you might have more trouble concentrating. A lot of people, they still function and they can do well academically or at work and things like that, but it might take longer to process information. Um, they are restricting different food intakes, different food groups, sorry. So they might cut out all carbs, or they might have specific rules that they follow, like I can only eat between certain periods of the day. And if they eat outside of that, then they experience higher emotional distress or higher anxiety. Mood changes quickly or are more stringent. So they might be irritable more frequently than people are used to them being more irritable. People who might engage in excessive exercise, it consumes a lot of their day. So really, those are some indicators. If it's consuming a lot of your day, like there's a lot of distress around making changes around or incorporating foods that you might fear is like that you might identify as like bad foods, because we identify a lot of people identify like the good food, bad food category.
Yeah.
And so if it creates a lot of anxiety, stress, high emotional reactions, then those are some things to look out for. Also, something else, for people who might weigh themselves multiple times a day,
Oh, wow.
body check a lot. So they might stand in the mirror for periods of time and take away from other things that are important. And body checking could be just like comparing pictures of yourself or looking at pictures of yourself. It could be feeling different body parts, actually pulling out a measuring tape and measuring your body parts. So it's really it really creates a lot of discord in your day and how you feel about yourself, how you function throughout your day. So those are some indicators.
So Sabrina, let me ask you, is the root cause typically some type of stressor, whether it be emotional or mental stressor?
So for people, their triggers might be different, but yeah. So with eating disorders, there's a 94% comorbidity between having anxiety, depression, or obsessive compulsive disorder and an eating disorder. So where there's high anxiety, people might use the eating disorder might be either, we don't know if the chicken comes before the egg or the egg before the chicken.
Right. Yeah.
But if someone has like high anxiety, they might use the eating disorder behaviors to cope with their anxiety, or in their mind, they're thinking they're coping with their anxiety by restricting their intake, because it periodically or for a moment, it makes them feel okay, but the distress starts to become higher because there's really emotional avoidance. So it could be depressive symptoms, so like having low mood, or just losing interest in things and really isolating yourself, having a lot of self-deprecating or negative thoughts about oneself, about one's body image that could play a role in it. So sometimes people assume that, well, you just don't like certain foods. That's a myth. It's usually something cognitive or emotional that's disconnected, and food is just a symptom of those things.
Right. We're talking to Sabrina Johnson. She's with Legacy of Love Counseling. We're talking about eating disorders here on our Wellness Wednesday from the Diabetes Action Council. I'm Tre Tailor, and you're watching Coping with COVID. So how do you treat it, Sabrina, once you recognize, or someone else in your family recognizes you have a problem? And that's the first thing, is to obviously recognize that this is a problem. How do you treat eating disorders?
Yeah, so like you said, the first step is recognizing that there is an issue because those behaviors become very ingrained and people we live like I said, we live in a very high diet culture. So sometimes people assume that people are just healthy, or that they exercise regularly and they commend them. So it's hard to really catch if you don't really know what to look for. But then once you do recognize, then it's really important to research shows that it's important to have a a team approach to treating eating disorders because it's not just psychological or
Right.
cognitive. So you want to go to therapy. I know, especially in the Black and Brown communities, we talk
Yeah.
about mental health, but we still have a long way to go.
So it hasn't changed at all, do you think? I mean, because listen,
Mhm.
I mean, and I was going to bring that up, and you're right. In Black and Brown community, I mean, we pray and mind our business. You know what I'm saying?
Yeah.
I mean, I'm speaking to the choir, so I know you already know this, but um, this, the pandemic has really taken a toll and uncovered some severe mental health issues and impacted so many people. Are we still not, has that not broken the barrier for us?
I think it definitely has broken the barrier. I think there are more people willing to talk about it, even if it's like in their social groups or at the barbershop, at the hair salon. Like more people are willing to talk about it on social media, and more people are actually willing to go to therapy. But there's still a lot of people who still have, which rightfully so, the mistrust in the healthcare community because of historical events that have created that mistrust. So I do think that it has broken that barrier, but we still have a ways to go.
Yeah.
In acknowledging things that we don't talk about within our community, like eating disorders.
Yeah. Yeah. So let's talk a little bit more about treatment. You said it needs to be a multi-pronged approach. Counseling is one. And then what are some of the other things that needs to happen to help people through their eating disorder conditions?
So, like I said, food is a symptom of eating disorder. So, definitely working with a registered dietitian who is well versed in eating disorders, who understands the cognitive aspect of it as well, but to help develop a better relationship with food because it is a symptom of it, and because eating disorders are very physical. Working with a medical provider as well. So going to the doctor regularly to get lab work checked. So we know that weight is one indicator of health, but it's not the best indicator of health. So especially with people who have eating disorders, they might have lab work that might be a little wonky. So they might have abnormal blood levels or mineral levels or things like that. And so, which could be really detrimental to health. So making sure that they go to the doctors to get regular health screenings. And if their physician is not well versed with eating disorders, then maybe finding someone who is, or they can consult with, like registered dietitians or counselors or other medical providers who are, to gain more understanding around how eating disorders affect people.
How easy or difficult is it? How challenging is it to find a physician or care team that specifically works with eating disorders? I know as a counselor you do. Are you able to provide some referrals?
So the community is very small.
Yeah.
There's very few far and in between. So I personally use the same individuals. It's been really hard to find medical providers who do treat eating disorders because they are so severe and they come with a lot of health risks, especially if someone is more on the severe side of having an eating disorder. There's still, I think, a lot of fear around eating disorders or the assumption that it's all psychological when it is not. There's a lot of people pass from the physical aspects of eating disorders and not just the psychological component of it. So I think a lot of so as far as creating a team, I still try to work with individuals, primary care physicians, and stay in contact with them and encourage that they get lab work and things like that. Sometimes in the past, I provided medical providers, these are the labs that I specifically need.
Yeah.
So they can give them to the registered dietitian so they'll know what to do with that, that kind of thing. So it's about a lot of education is still needed in that area.
And so if someone is, I guess, noticing that their family member, that their loved one, that their friend
Mhm.
may have something going on,
Mhm.
specifically an eating disorder in this case, how do you approach your friend? How do you approach your family member? What do you do?
Yeah, I would definitely say be gentle because they are struggling. They might not say they're struggling, but they are, and it's really difficult to acknowledge. A lot of people who have eating disorders carry a lot of shame and guilt and embarrassment because they
Yeah.
do. They think a lot of people don't struggle with food or, their body the way that I do. So there's a lot of shame around it. So like directly stating it and calling it out might be a little harsh for some people. And we have to remember that if they're not nourishing their body properly, cognitively, they can't really, there might be a delay in comprehending that concern. And so being gentle and then using additional resources. So like the NEDA website, the National Eating Disorder Association website, has some really great tools and resources to use for families to address those issues. If your child is in school, then you or a person is in school, then you could use whether it's the school counselors, if they're like middle school, elementary school, because they can suffer from eating disorders as well too. Or college, using the college counseling center if they have a team there. Fortunately, I was able to work at a university where we had an eating disorder team that I was a part of. And so we worked collaboratively with, and I was the case manager. So I had to talk to a lot of people, about our concerns regarding their eating behaviors. So pulling in additional resources and being gentle. And if they are more severe, there could be a lot of resistance because of that guilt, shame, and fear around what treatment looks like. And there are 3 different tiers of treatment. Or 4. There's community. Well, 3. You can do it in the community, intensive outpatient, where you're going maybe 3 or 4 times a week. Partial hospitalization, where you're going maybe every day, but you're still coming home at night, and then residential. And a lot of people think automatically I'm going away to residential treatment, which might not be the case. We know a lot of people they actually do have like good medical lab work, but the other behaviors are more severe and that could quickly change. So there are a lot of factors that go into play. So pulling in all the resources that you can to talk to a family member and expressing that concern is really the way to go.
Right. So do your research first, and then when you come talk to them, have your arsenal ready so that you can, give them the resources they need. That's good stuff right there. Yeah. So we're talking to Sabrina Johnson. She's with Legacy of Love Counseling. She specifically works with Black and Brown women with eating disorders and Black and Brown couples that are, want to do premarital counseling or marital counseling. And she's joining us today. I know your practice is primarily telemedicine, so to speak, virtual. Is that obviously that has expanded due to COVID.
Yeah.
Do you think people feel more comfortable if they're in their own space as opposed to going out to, visit a counselor?
I wouldn't say more comfortable. I just think that I've had the same response, whether in person. I've personally had the same response, whether in person or virtually. I do think one of the benefits of being virtual is like the flexibility with the hours.
Yeah.
Because I see most of my people in the evening, so they don't have to take off work or anything like that. So the flexibility has allowed an increase to access to services. When working with people who have eating disorders, one of the downfalls is you can't really get like a actual full picture of the person, because it's really important to be able to physically see how somebody is changing with the eating disorder. So whether they've lost weight since the last session, or there are other concerning things happening that you can physically see. So there are some things that we can miss. But as far as like receptiveness goes, I think it's been pretty much the same whether in person or virtual.
Yeah. Sabrina Johnson is with the Legacy of Love Counseling. Her information is on the screen. Seek her out if you are a Black and Brown female, or if you know someone who is concerned about eating disorders, or if you are a Black and Brown couple that wants some premarital or marital counseling. Sabrina Johnson with Legacy of Love would be glad to bring you on as a client. And she does do virtual telemedicine. Sabrina, anything else you want to share with us before you leave as far as eating disorders and COVID is concerned?
Yeah, one thing I think is important to note is that when we talk about eating disorders, a lot of time we just think about it in the context of white women, when that is not the case. Like Black women are just as affected, as well as other races and genders. The research is just limited on those populations. And a lot of times they go underdiagnosed or not diagnosed at all. So if there is an issue, like I would recommend that people really advocate for themselves if they feel like, okay, I really need help. And speak up, whether, because we know that the primary interest to mental health usually starts at a primary care doctor. So being able to learn how to advocate for yourself, or even for doctors to start implementing like screeners for eating disorders, like the SCOFF questionnaire or things like that, so they can start to capture more people who might be struggling with eating disorders because they might not say it right out. So, yeah.
All right. Well, if you want more information, once again, Sabrina Jones with the Legacy of Love is available. Sabrina, thank you so much for sharing this great information. Thanks for doing the work, girl. I mean, you know, as a therapist, as a counselor, I mean, you are really out here helping folks have productive and fulfilling lives, because, girl, I tell you, I don't have to tell you, if your mind ain't right, you know, that just affects so many other things.
It is really hard.
And everybody around you. So, you know, so thank you so much again for joining us. And we got to get you back. We want to talk about what you do for premarital counseling. That's a big thing too.
Yeah, I would love to come back. Thank you.
I would love for you to. Thank you so much, Sabrina Johnson with Legacy of Love Counseling. I'm Tre Tailor. Listen, if you have a story or initiative that could help someone cope with COVID, please email booking@Coping with Tre Tailor. Booking@Coping with Tre Tailor. That information is scrolling at the bottom of the screen. If you have a product or service that could help someone cope with COVID, please email copingwithtretailor@gmail.com. We would love for you to be a proud sponsor, just like our Wellness Wednesday sponsors, SC DHEC, Edit Together SC, and the Diabetes Action Council, and our other sponsors, Javis Financial Services, the City of Columbia Office of Business Opportunities, Palmetto Media Connections, also Palmetto Painting, Agape Counseling and Training Services, Black Expo, Black Pages, Computers Unique, Dutch Square Mall, the Comet Bus System, and then the Fifth Circuit Solicitor's Office, Attorney Byron Gibson. They'll be with us next Thursday, as a matter of fact, for their second Thursday. And they're going to talk about various resources that are available in our community for those of you who are doing work on the ground, those nonprofit organizations that are doing some great work. Attorney Byron Gibson sponsored an event a couple of weeks ago, and we're going to bring some of those service providers on the show next Thursday to give you the information, funding information that is available. And there's lots of funding information available for nonprofits, specifically those folks that are doing work in our community. We're also going to talk Friday about First Five. This is an initiative from the early childhood development folks in South Carolina. And it's kind of like one-stop shopping to get all of the resources that you may qualify for your 0 through 5-year-old child. We'll talk to those folks on Friday. Also going to talk to the folks from Unshakable Faith. They've got a beautiful story of resilience. And coming up, is former NFL player, Columbia, South Carolina native Corey Jackson has a great new initiative. And CNN contributor, attorney Bakari Sellers, is also going to join us to talk about his brand new book. That and more coming up on Coping with COVID. As always, we leave you with a reading. We're reading today, and have been reading since the beginning of the year, Conversations with God. It's from Cheryl Mims Williams with Agape Counseling and Training Services. And I'm in the chapter that says Desires of the Heart. And it says, Father, it's a prayer. I pray for strength that you activate your power within me. I know you have already put your spirit in me. I am strong. I am powerful. I am meek. I am gentle. I am compassionate, and I am comforting. I am these things because I have your spirit inside me. What a beautiful prayer to encourage and empower yourself every single day. And it's in Conversations of God from Cheryl Mims Williams. at Agape Counseling and Training Services. I'm Tre Tailor. Hey, thank you so much for joining us today on Coping with COVID and on Wellness Wednesday from In It Together SC and the Diabetes Action Council of South Carolina. Until the next time, I wish you peace, abundant blessings, stay well, take care, God bless. Don't forget to post and share this information out. And don't forget to wear your mask over your nose and under your chin. We'll see you.
Coping with COVID and In It Together SC present Wellness Wednesday, brought to you by the Diabetes Action Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Tre Tailor.